Good afternoon, everyone. Thanks for the kind introduction of the chairman. Today, I will show our study result and brief of our study group. During this pandemic of COVID-19, approximately 38 million people living with HIV worldwide are at risk of infection with severe acute respiratory syndrome coronavirus 2 SARS-CoV-2. To contain the pandemic, travel restrictions, social distance, and the lockdown have been impediment, which could potentially have adverse impact on HIV testing and care delivery. This study aims to investigate the impact of COVID-19 pandemic in Taiwan on key components on the HIV care, HIV testing, and the retention in HIV care in 2020. The material method study site in the University Hospital in Taipei. Study population HIV testing to describe the number of clients seeking undergoing HIV testing in the same period between 2018 and 2020. People living with HIV. Observational study design 1st January 2018 to 31st December 2020. Follow-up until to 31st December 2020. The laboratory investigation, hepatitis V surface antigen, HBsAg, rapid plasma agent, and the antibody to hepatitis C virus or HCV viral. Plasma HIV viral limit detection 20 copies per millimeter to show the quality of care. Change in testing number in these 3 years of the above tests will be shown. Definition: continue of assay ART. Clinic visit grade or equal to 2 times per year, including reviews and delivery by mail with access of their friends or families. Those to follow up. Clinic visit below 2 times per year. This slide shows the HIV testing number at VCT in 2018 to 2020. We did not have COVID-19 confirmed case during 2018 to 2019. Blue bar is HIV testing number in 2018. Red bar is HIV testing number in 2019. The testing number was stable in the 2 years. Our testing number in 2020 declined significantly from April to December due to COVID-19 confirmed case. This table shows the total case number was 30,000 from 2018 to 2020. The HIV infected patients in 2018 were followed up until the end of 2019. The discontinuation rate is 3.4%. The HIV patients in 2019 were followed up until the end of 2020. The discontinuation rate is 3.6%. This slide shows the distribution of people living with HIV from 2018 to 2020. The blue color shows the retention rate is stable around 95% to 96% from 2018 to 2020. The slide shows the number of RPR testing by year. The red color is testing number with 1 to 2 times per year. The percentage of RPR testing number with 1 to 2 times per year was 54% to 56%. The total testing number were around 707,000 to 709,900 in these 3 years. This slide shows the number of plasma HIV viral by year. The red color is testing number with 1 to 2 times per year. The percentage of plasma HIV RNA testing number with 1 to 2 times per year was 54% to 57%. The total testing number were around 7,800 to 7,900 in these 3 years. This slide shows the number of hepatitis B surface antigen testing by year. The red color is show the testing 1 to 2 times per year. The testing rate increased from 32% to 49% around the 3 years. The total testing number increased in these 3 years. This slide shows the number of antibody of hepatitis B, C virus or HCV viral testing by year. The blue color shows no testing per year. The percentage of no testing declined from 33% in 2018 to 11% in 2020. The total testing number increased in these 3 years. The status of plasma HIV viral suppression by year. The percentage of viral less than 50 copies were around 39.9% to 33.4% in these 3 years. This is our conclusion. During the global COVID-19 pandemic, the control measures have significantly reduced the access to testing for HIV among the at-risk individuals. The impact of continuation of access to ART and the monitoring of biological response and the sexually transmitted infections among people living with HIV was minimal in Taiwan in 2020. Thank you for your attention.